What is cervical cancer? What is the cause of cervical cancer? How is it gotten? How is it treated? Can it be treated? How is it prevented? Now, the most important question people ask, are men supposed to take HPV vaccine or is it only for women? In this video, I'm going to explain everything you need to know about cervical cancer. So, stay to the end of this video. Now, cervical cancer is the cancer of the cervix. Yes, it happens in the cervix. The cervix is what connects the uterus to the vagina. Now, what is the cause of cervical cancer? Cervical cancer is caused by persistent infection by HPV. What do I mean by persistent infection? Some human papillomavirus enters your body and stays for years, and some of them resolve by itself. Some stay for 1 to 2 years and they are self-limiting. They go away on their own. Whereas some stay for years and they refuse to go out. They still stay in your body. These are the ones that can cause you cervical cancer because they cause abnormal cell changes. From there, they cause you cervical cancer. Now, how is cervical cancer gotten? Cervical cancer is gotten by sex. Yes, sexual intercourse. And this is not something you should be ashamed of. There is this stigma because it is only gotten through sexual intercourse. Most women will have this HPV virus in their lifetime. Just that it's not all HPV virus that causes cervical cancer. Some are self-limiting. That is why you should always do this HPV screening. The ones that causes cancer is the high risk strains, HPV 16 and HPV 18. They are the high risk strains. They are the ones that causes cancer. Not all HPV causes cancer. Now, what are the risk factors? The first one is having multiple sexual partners, smoking, having unprotected sexual activity, early sexual activity, not going for screening, weak immune system. These are the risk factor of HPV. Now, what are the warning signs of cervical cancer? In the early stage, you will not see symptoms. It is asymptomatic. Yes, you will not see symptoms. But in the later stage, you start noticing several symptoms like lower abdominal pain. You start feeling pains in your lower abdomen. You start having bleeding in between periods. You start seeing bleeding after sexual intercourse. You start noticing vaginal discharge with awful smell. These are the warning signs of cervical cancer. Now, how do you screen for cervical cancer? There are 2 types of screening. The first one is pap smear. The second one is HPV test. So you can walk into any hospital of your choice and demand for this test. Now, how do you prevent cervical cancer? You prevent cervical cancer by taking vaccine, early vaccine. Girl children from age 9 should start taking vaccine. It is very, very important. You also prevent it by avoiding multiple sexual partners, by using condom. Yes, use protection, and by doing screening. So always go for screening. These are the ways you can prevent cervical cancer. Now, should men get vaccinated? Yes, men should get vaccinated. Although men cannot get cervical cancer because they don't have cervix, but they can have penile cancer. They can have throat cancer. So they should also get vaccinated against this HPV virus. Yes, it can be treated if detected early. If it's detected early, it can be treated through surgery. If detected late, it can also be treated through surgery, radiotherapy, chemotherapy, but the survival rate is very low if detected late. Hope you learned a lot from this video. Don't forget to share this video and don't forget to subscribe to our channel. We'll see you on our next video. Bye bye.